Nice to meet you.
Nice to meet you, man. How you doing?
What is this?
Oh, she just gave this to me.
Okay.
Would you mind holding it?
Let's see how he's walking. All right. Where do you have pain right now?
There's like my lower back, like right here.
And you just fell.
Yeah, I fell right on my back. while
Just
roller
today,
skating.
right?
Last night.
Last night.
Yeah.
Okay. So go ahead and walk up. I'm gonna be right behind you. See how you're walking. So you just kind of lean forward, huh?
Yeah, that's how I don't feel the pain. Yeah.
So when you go backwards, it's kind of pretty.
Yeah, that's where I start feeling.
I got you. So you might have maybe a disc that might be out. We'll start by taking some X-rays. Do you have a belt on?
Yeah.
So take your belt off. Just leave everything. On this table. Just leave it there. Yeah. And then empty your pockets too, so that way we don't see metal.
All right. I think that's everything.
Okay.
Good. Just go in there.
Yeah.
All right.
Right there. Just stay the same. Turn off the lights. Right next to me, please. Okay, so we just x-rayed the spine, full spine x-ray, cervical, thoracic, lumbar. Here's the AP view from the front. And here is the lateral view. And as we saw, the patient's leaning forward. There's no curve there. There's a bulge at the base. And here we can actually see the sacrum and the L5 are bulging from the back instead of the front. So in this particular case, most likely the pressure is within the sacrum. S1, S2, S3, S4, we'll palpate those segments and go back to the x-ray again. And once we find the right segment, then we'll go ahead and address the patient. Just stay there. I'm going to scan you with my scanner. I'll use two different ones. You didn't sleep much last night, huh?
I did sleep well, and
Let's pull this out. Yeah, go ahead and take your shirt off. Take them both off. Pressure at L4, L5. Once we get to the sacrum, it kind of eases, but right around this area. So most of the pressure is at L4, L5, and of course the sacrum. Let's check the rest. Now, when you fell, did your head hit anything?
no, I kept my head up.
So pressure at C7. T4. And right after T4, it kind of just stays there. Stays on the left. It stays there. So right from here, that pressure doesn't change. It stays pretty consistent to the left. How's this bone?
That hurts.
It hurts. Okay, so I'm going to start setting this vertebrae first. And we're going to see if anything changes out here. So in order to get a good set there, we can't use the high-low because the patient can't go into extension, so we're gonna do it on the knee chest. So come over here, I'll tell you what we gotta do. Because you have so much pressure in your lower back and you can't go back this way, this is what you gotta do. You gotta put your knees there, and you can take these off.
Okay.
Yeah, and then put your head, yeah, let's bring this up a little bit. Put your head in there. So you can have that back the way that it feels comfortable. So bring your knees forward a little bit. There you go. Okay, good. All right. And see if you can let the chest kind of rest there. There you go. Is one more tender or two?
One.
One.
I think, what does tender mean exactly? What do you
Painful,
mean?
yeah.
Yeah,
Right
definitely
there.
one.
Yeah. So relax these shoulders. Make sure you're not holding anything. I'm going to set this one first. This is T4. Relax your shoulders. There you go. Good. You got movement. This time we're going to go a little deeper. Just go ahead and breathe in and out. Good. Your shoulders are too high. Drop them down. Good. Breathe in again and out. Stay out. Keep going. Keep going. Okay, we got more. Work your way up. Let's go back to the chair and let's scan it and see what happens.
On the chair?
Yeah, back here. Just sit right here, face that way. So the pressure's clear from T4. It stays clear until we get to the sacrum. Okay, so see if you can stand up a little bit more straight right now. Go ahead and stand up. Right. You actually can.
Yeah, a little bit more, yeah.
Yeah, so, which is really strange. I mean, pressure is here when we adjusted T4, but the patient couldn't extend in any way. He was in a flex position, but after setting this, he's able to stand straight again. Okay, so let's palpate the sacrum next. Just keep standing. We're going to look at the sacrum and see which side is posterior. (59, 61). So the right side is posterior. Okay, let's go for a walk. Let's see if it's easier to walk. All right. Before we do anything. And you can just walk to the end of the hallway for me. You can bring your head up. You don't have to bring your head down. All right. Long, wider stride.
Yeah.
Okay. Okay, not as painful to walk so far,
Yeah.
right?
Yeah, a little bit better. For sure.
So now I'm going to palpate, we said the right side is posterior. So let's have you on your side facing me with that right side. So put your head on the pillow and face me. So I'm just going to touch that bone, okay?
Okay.
So here we go. This is the last vertebrae, L5.
Yeah.
This is the sacrum. So let's go on S1. Here's S1. And let's go to number 2. Is that sore?
That hurts really bad.
That hurts really bad. Okay.
Yeah.
And here's 2.
That one's not as much.
And here's 3.
Not as
And
much.
here's
either.
4.
Yeah.
And 5. Okay. Now let's feel that again. Here's L5. Not too bad. But once we go to that sacrum, you really feel that pain.
Yeah, yeah.
Okay. Go ahead and stand up. Let's see which side is locked further. So stand right here. I'm going to be behind you. Okay, let's have you go to the right. Does that bother you?
A little bit, yeah.
And go to the left. Does that bother you?
Not as much.
Not as much. So we got the pain more on the right side when the patient leans to the right and pinches down here. Let's do it again. When you go here and you feel the pressure where my finger is, right?
Yeah.
More like down here or more like
yeah, right there.
Right there. Okay.
Yeah.
So now we've narrowed it down. Right sacral base posterior, S1. Let's set it. Lay on your side, face me. So because of the degree of pain, we're going to do a pull move, which is faster, and the patient can tolerate that a lot better. Try not to resist, so the set is going to be pretty quick. It'll be this way. It'll be more of a push move using my arm. So.
Okay. Oh,
We got movement.
yeah.
Good. All right, let's come up. We're going to go for another walk.
Okay.
You're walking faster.
Yeah, no, sweet.
Okay. So when you were going to that right side, right, it was
Yeah.
hurting a lot more. Is it less when you're going? I know you feel it, but is it less?
Yeah, it feels a little less painful.
Less pain. Okay.
Yeah.
Let's get another reading on the chair. And
let's sit down.
Yep. Okay, so still some pressure, but less. Now, what we'll do is we're going to take a second x-ray to see the changes. Let's go to the x-ray room and take another one. Okay, so here is the x-ray that we just took before the adjustment. And you can see how the patient's leaning forward. The open wedge is here at L5, S1, the back part of that disc. And after the adjustment, we did another x-ray. Here's just a lateral view, and you can see his curvature is coming back. And if we zoom into that L5, okay, you can see that the starting to develop that wedge back. All right, pretty nicely. Okay, good. And you know, in this particular case, this one is one of those exceptions where something else is causing the problem. Something up here was causing the pressure down here. So if someone comes in with back pain and we're just saying, okay, he's got back pain, let's just x-ray the back and just adjust the back, we might not be able to help them, especially after a fall where other areas could be affected. But his T4 is all clear. His low back is better. We're going to follow up with him probably on Monday to give him another adjustment in the lower back. But I will give him another adjustment up here because he's got a ton of pressure on that C7. Hopefully you don't crack your own neck, do you?
Yeah, I do actually.
You do?
Yeah.
Well, How often?
For every day.
Every day.
Every few hours, I'd say.
Did you do it today?
No, I haven't done it today.
Okay. So cracking the neck is not a good thing because you don't crack something that's stuck. You always crack something that is loose or normal. So here's an example. Like if there's a bone here and you feel stiff in this disc here within these two vertebrae, and if you're going sideways, you're not cracking the one that's stuck. You're cracking something else. So don't crack your neck. You're really going to mess it up. So when we see the neck, I clearly saw your neck. It's way too forward, and it does seem that you do your own popping and cracking. So you can see there's no curvature. So we wanted to have a little bit of a curve. So it's really tight on that left side. Really tight. He just almost doesn't want to go. So let's do a C7 adjustment. The set is going to be straight across. I'm going to go deeper. A little more. Okay. And that's what we usually expect with people that crack their own neck. And if it doesn't move on the chair, we'll have to set it face down. Okay, got it. I had to pull it from the right. Let's see if we got that reading cleared up. Completely clear. So that was a good movement. Lean forward. We're going to do one more check down here. All right, I feel really comfortable leaving you alone.
Yeah.
You got to let this thing heal. Put some ice on it when you get home.
Yeah, well.
Yeah, and then don't slouch. Keep that back arch as much as you can. I know it's still not 100%,
Yeah.
but it's way better than what it was when you came
Oh,
home.
yeah, definitely.
Yeah, but this is one thing that, you know, most people, sometimes we film these because, especially in this particular case, what did I adjust first?
My back.
Which part of the back?
Upper back. Yeah.
Here.
Yeah.
And instantly, right after that, you were
Yeah.
able to stand
I was
straight.
already feeling
Isn't that crazy? But you had no
Yeah.
pain there
Yeah.
in the upper back.
I didn't
So-
feel much.
Yeah, not up here.
Yeah, not up there.
Not until it's
on the
like-
bottom. Yeah.
Not until I pushed on it, and then
Yeah.
you're like, oh, that thing is not comfortable.
Yeah.
All right. So, do you have any questions for me for today?
No, that's about it. It's pretty
Okay.
good.
Well, good. We got it.
Yeah.
All right. I'll see you back sometime next week.
All right.
Okay.
Yep. I will see you next week, hopefully.
Yeah.